And now it's my pleasure to introduce our next Spotlight Series speaker, Dr. Stephen Child, who is the Chief Medical Officer at Southern Cross Health Society. Dr. Child, a recipient of an NZMA Fellowship Award, is making an impact in the health sector by building sustainable, trust-based relationships. Dr. Child will give us, in a similar vein to a TED talk, just 15 minutes on the future of health. Dr. Child.
I don't usually get nervous giving a talk, and I was just sitting there thinking, I feel nervous for the first time. So I started thinking through my slides what I was going to talk about, and then I realized, actually it's easy. You're talking about the future. You're almost certain to be wrong, and no one is going to be able to remember to quote you on what you said. So in the next 15 minutes, hopefully what I'm going to do is I'm just going to have a general chat about what I think are the key issues of where we're going in health in general. And I could summarize it really by saying that these seem to be the three issues that are out there today. One, and this is worldwide, there is an increasing gap between what we are able to fund and what we need to fund. That's in every country of the world, especially in every democracy of the world in which it is particularly difficult. Because of that, there is an increase in private funding for people who pay out of pocket for what they receive, because no taxpayer base is able to fund all the expectations that are increasing rapidly. And the third issue, which is slightly controversial, but I'd be happy to chat about afterwards, is a lot of the technology that we are seeing in health today is generated as commercialization for profit. Companies are creating advances in health, preying upon your vulnerability to put money in their pocket. And those are the three things that I'm going to chat about in the next 15 minutes. So it's interesting health. The University of Auckland Medical School curriculum now says there are 191 medical conditions that affect the human body. The curriculum says in the next 6 years, you just learn those 191 conditions and you graduate as a doctor. Interesting. Actually, 12 of those are public health reviews. Really, there's only 179 things that affect the human body, and that's medicine today. We know the big picture of health funding in New Zealand. Most people in this audience will know that. They will know that the public sector basically contributes about $16 billion out of our taxpayers' money. ACC chips in about $4.5, and we in the private health insurance market are about $1.5 billion. So we're contributing about 5%-ish to the healthcare population in New Zealand of where we play. And this is the slide that presents where the problem lies, in that this is a slide looking at funding from 2009 until 2018. And what you can see, if you look at the orange line is what has happened to increase in costs for health expenditure in general. And if you look at it as a percentage of GDP, which is the green line, you see that ever since 2013, the proportion of GDP that we spend on health has been going up quite considerably, the public sector contribution to health. And because the public sector contribution to health has not kept up with the increase in health expenditures, the private health insurance market in general is the blue line and the yellow line. And so you can see the gap is increasing. In other words, the public contribution to those 191 conditions is reducing, and the private contribution, one way or the other since about 2013, has been increasing. And the problem with that is this very issue. So this is 2013, the strange green, lime green, I guess, color line is what's happened to the claims paid by all health insurers since 2013. Gone up 47%. The number of people with health insurance in New Zealand in that same time has gone up, the turquoise blue line, 5%. Population of New Zealand, though, has gone up 11% in that time. So arguably, the proportion of the health insurance market in New Zealand has been shrinking as a proportion, even though the total number has been gradually increasing. And a lot of what's happening in health is patients' expectations has been changing as well. 50 years ago, you went to your doctor, and your doctor would even do a house call 50 years ago, and they would tell you what's wrong with you, and you would trust the predominantly male, older doctor who you would go to 50 or 60 years ago. And then we came up with this idea of a patient-centric approach. It's all about the patient. The patient is actually not even allowed to use the word patient anymore. I'm not sure what the correct word is. I think it's client or customer or some other word is creeping into the medical words. You're not allowed to use patient. And then, of course, technology means that we're putting a lot of the health in your hands. Well, that's a good thing, isn't it? That means you can know more about your health. We've increased your health literacy. And in fact, your phone can do an awful lot right now. Your phone can tell you how many steps. It can tell you how you slept last night. It can tell you what your heart rate is. It can tell you what your what your oxygen concentration is if you get the right app. For $6,000, you can clip something into your iPhone and do your own echocardiogram of your heart and maybe check in an ultrasound of your gallbladder while you're going. The phone is incredible. And Google knows this, Microsoft knows this, Apple knows this. They all have health departments that have been actively working since 2003. This is just a picture of some of the things that they are doing. They have a bathroom mirror now that the bathroom mirror will look at you and tell you whether you're depressed. It can look at you, it can know the color of your skin, it can look at the temperature, it can look at your facial expression of your muscles and so on. And so it can tell you, you're depressed this morning, or you didn't sleep particularly well, did you? Man, it's a whole new world in technology and health. And that's got to be a good thing, doesn't it? Well, is it? Let me give you this little example. Moles. We all have them. 60% of the population will have a little, it's called a nevus or a nevi, which is just a little brown spot somewhere on you. You all know you have them. Very, very common. So I'm going to invent a new machine. In fact, it's on the phone already. And what I can do is I can use my phone and I can take a picture of that little mole and it'll tell me whether that mole is cancer or not. And my machine has got a 95% sensitivity, it's called, and a 90% specificity. So I'm going to come and present to some venture capitalists about my new idea, and they're going to be businessmen, and they've got businesswomen, business people. They're going to have lots of money. They're going to go 95% accurate at picking up lung cancer. Oof, I'm going to invest in that one. What a great idea. Let me talk to you about sensitivity and specificity. What that means is if my machine looks at 1 million lesions, of those 1 million lesions, 100 of them are cancer. That means my machine will pick up the 95 of the 100 that are cancer. It'll miss 5 of them that are cancer. And it'll diagnose 100,000 of them as cancer that weren't cancer in the first place. For any test we develop, so my machine is going to fail, isn't it? I mean, the moment I miss one of those cancers, I'm going to be on the front page of the Herald or even the New York Times, and that's the end of my machine because I missed a cancer. So I'm going to have to set this machine to make sure it never misses cancer. I'm going to have to rank up the sensitivity so it's 100% accurate. What's that going to do? It's going to increase my false positive detection multifold. So for every one cancer I'm diagnosing, I could be looking at 100, 200, 500 false positives, which is going to generate more business for my business, and it is going to generate more income and cost to the health insurer. And talking about cost, this is just a picture of a friend of mine who had one of those removed from the side of his cheek, and this is the actual invoice. He tells me that he walked into the room and was out of the room in 22 minutes. And he knows that because he sent a text just before he went into the building from the car park, and he finished his phone call when he got back, so he's got it on his phone. And he was charged $1,500 was the surgeon's fee, plus $975 was the theater fee. So suddenly, my machine is going to generate some serious money, isn't it? Because for every one of you I scare and tell you your little mole might be a cancer, I'm going to generate a heap load of health claims and health costs, and you're going to make me very, very rich. I work as a lung specialist in private. When you go for a chest x-ray, what's the first thing they tell you to do? Take a big breath in. Well, as soon as you've taken a big breath in, the radiologists will report that chest x-ray and say there might be some hyperinflation of the lungs. You could have emphysema. So you get referred to me. So I get about once a month someone referred to me because the chest x-ray suggested they might have emphysema. They don't have emphysema, of course. It takes me about 4 minutes to figure that out. But we've just generated money for the healthcare system. But it's a free market, isn't it? I mean, I can do this kind of stuff because it's a free market. It's not a free market in health. It's not a free market because there's an imbalance of information. In fact, they say that the health is like flying into Tripoli in Libya and hailing a taxi. After the taxi ride, you can tell what the value of that taxi ride was. But before you get into the taxi, you may or may not be able to judge whether this person is going to rip you off, take the shortest route, how it's going to go. Health is like that. You can't know beforehand, so it's called a credence good. And it's for that very reason that doctors, nurses, most regulated professions swear a code of ethics. And that code of ethics begins, I pledge to consecrate my life to the services of humanity. That's the opening pledge of a doctor. So what we have said is we pledge to not prey upon your vulnerability. We pledge to serve you. That is our commitment to our profession through our code of ethics, and to not prey upon the vulnerability of your health. So trust is an interesting thing, isn't it? This is an international survey of trust called the Edelman Trust Barometer that has been doing measurements of trust in multiple different countries, and this one is 22 countries of the world repeatedly. And what did we see? Trust in search engines, traditional media, owned media, social media has dived since 2019. Trust in general, trust in usual resources has changed. And this is an interesting slide. This is just looking at healthcare sector in January 2020. Remember when the virus was first being discovered? To May 2020, trust in healthcare went scooting up as everyone was talking about COVID and how wonderful we are to have everyone helping us out. From May 2020, though, to January 2021, it plummeted to below where it started from. And as you all know, there's conspiracy theories and all sorts of rubbish out there now, and so no one knows who to trust. We used to trust in individuals. We used to trust in doctors and to ministers and teachers and politicians. Yes, we did. We trusted in individuals as people 100, 150 years ago. And then we kind of evolved and we started to trust in institutions. Well, the church says it's okay, the school said it is okay, the government said it is okay, and so we believed, academics, scientists said it was okay. Now, what do we trust in? What's happened to trust? And I got this slide from a friend of mine who said, you know, it's interesting, when she goes to a hotel and you've got the dirty towels after you've been in the hotel room, she often just chucks them on the floor, but that's fine. But when she goes to an Airbnb, she always folds her wet towels and puts them properly on the side of the bathroom. And she goes, why? Because on Airbnb, I'm going to be rated, and that matters to me. In other words, trust today is transparency. What we've done with trust is same thing. We've said, let's be transparent about what we're doing, and that's the only way we can trust. So what's going to happen in health? These are my predictions. That, as Stephen Case said, who was one of the inventors of AOL, one of the original computer companies, he has written a book. And when he talks about the computer industry in general, his core message is the number one thing that the IT industry needs to be looking forward going forward is regulation and trust. Because what we can do and what we should do are increasingly becoming two different things. So in this post-truth world, I think we're going to see increasing problems with trust, and you're not going to... What happens if your Google misses your skin cancer diagnosis? Who are you going to sue? Is ACC going to cover a misdiagnosis if Google has done it? How, are you going to get your money back? How are you going to get a rating of whether my little machine that I've invented is any good or not? Are we going to have a self-rating system? How do you decide whether a doctor is good or not? Are we going to go rate my MD? Are we going to say that person seemed like they were a nice person? But you have actually no idea whether they were any good at picking up the little polyp that was in your rectum. They just seemed nice. How are we going to rate what is truth? And commercial opportunity. They're going to have an increasing preying upon vulnerability. Apple, in their smartwatch, did a study recently, and what they determined is the proportion of the population, of all of you, that will have an irregular heart rate for at least 30 seconds. And they published that in the New England Journal of Medicine. I can't remember what it was. It was 6% of the people they studied, I think. That's great, but what does that mean? Sometimes maybe you're all having irregular heart rates every 30 seconds. Does that mean I should treat it, not treat it? Does that increase your risk of stroke? Doesn't it increase your stroke? It's information that just increases your worry, but doesn't help me. Patient expectations are increasing. Increasingly as patients, you think now, because you can do all of this stuff, you're going to fix me. No, we're getting information faster than we know what to do with it and how to treat it. And rights versus responsibilities. Who should own this information? Now, Southern Cross, I possibly have drunk the Kool-Aid. We're a non-for-profit friendly society. We set our premiums based as age-related. But if you look at the big bad insurance companies in the US, for example, do you want them to know your data? You want them to know how many steps you did and what your BMI is and whether you're happy or not in your bathroom mirror? Because they're going to just set their actuarial risk based on this data. So who should be owning this data? And the biggest problem, I guess, that I would finish with is the inequity that this occurs. For example, all this diabetes monitoring now that they've come up with, you can just get a little patch on your arm, you can Bluetooth your phone over top of it, and it'll tell you what your blood sugar is right now. Wonderful compared to pricking your finger and having to do all that little measurement for people with diabetes. That's great. But the problem we have in diabetes in New Zealand at the moment is because of the high increased BMI, and most of the people are not even testing their sugars in the first place or taking their medications. So machines like that are going to help the top 4 to 5% of high socioeconomic working people, but the majority of the burden of diabetes in our society is not going to be addressed, and we're just going to be increasing the inequities. So thank you very much for your patience and for your time. I'm probably going to be completely wrong, but I hope I've raised some questions in your mind about, is that new technology a good idea or a bad idea? Who's going to be monitoring it? And should I say something about that? Thank you very much for your time.
It was great. Some disturbing stats there and some equally disturbing glimpse into possibly the future of health. So thanks for sharing that with us, Dr. Child.